Aloha Hawaii and welcome back to the Weekly Dose. I'm Brooks Baer for the Department of Health, and congratulations Hawaii, 1 million shots in arms. That's fabulous. We have recently passed the 1 million COVID-19 vaccine doses administered in the state of Hawaii. That's a wonderful milestone. Let's keep that momentum going, Hawaii. Let's get out of this pandemic as soon as we can by masking up, maintaining physical distance, and please, when you have the opportunity, embrace the vaccine. And here tonight to talk about the vaccine and the job at hand with getting to our next million mark is a physician from Kauai who has been instrumental in the effort over there to get shots in arms. With me now is Dr. Warren Sparks. He is a board-certified emergency medical doctor. He is also a family practice physician. And I think most important of all for us, he's been volunteering at a clinic in Lehue. Doctor, thanks for your time tonight.
My pleasure.
Tell me what you've been doing because you know while you could be out working, you're taking some time every week to spend at a clinic volunteering, I guess putting shots in arms.
Well, about half the time I'm there, I'm putting shots in arms, and the other half the time I'm running the observation unit where we watch people in an auditorium for 15 or 30 minutes if they've had a history of allergic reactions, during which time I get to chat with them.
And I'm curious as to what they tell you about why they chose to get vaccinated, and I'm really curious as to what maybe you share with them.
I share with them a couple of things that don't make it on the news very often, okay? We do talk about the efficacy of the Moderna and the Pfizer and the J&J and so forth. And some of that is apples and oranges. It's not really fair to compare a vaccine that did not have to deal with the South African variant because it didn't yet exist when those studies were done. But be that as it may, it appears that all the vaccines out there, all the vaccines in the world, not just the 3 that we have in the US, all of them offer something that doesn't get publicized very much. We don't like to say 100% in medicine, but this is near perfect protection against death from COVID or intensive care unit admission for COVID. And those are the numbers that really matter to me. I can look around that auditorium, the people who've just been vaccinated, and I can honestly say, nobody in this building is going to die from COVID. Nobody's going to be in the intensive care unit because of COVID with a tube down their throat, on a breathing machine, unable to speak, and no visitors allowed. This pandemic has been heartbreaking. It's been horrific. It still is in Michigan right now. It's the worst thing I've seen in half a century of practice. And the cure is at hand. The end of this pandemic is the vaccine.
You are obviously a champion of the vaccine. I can't imagine in your whole career in medicine, you've been able to talk about too many things as near perfect perfection, as you just called this vaccine. Why the reluctance then? Because I know you talk to people, we all come across people who, for understandable reasons, are reluctant, at least initially.
There are a lot of reasons for the reluctance. First of all, when we talk about encouraging people, because that's part of my talk to the people that are in observation, is how does one go about persuading a family member, a friend, a neighbor, or a coworker to embrace the vaccine. What doesn't work is to shame people for their fear or to ridicule people for their misunderstanding or lack of scientific knowledge. I'm very clear with people that after we are vaccinated, we must continue those social mitigation strategies of distancing, hand washing, or hand sanitizer and mask wearing when we're out in public. But we can get together indoors with other vaccinated people and drop our masks. And we can get together indoors without a mask with unvaccinated people like the grandchildren, as long as they're in the same household. If we begin mixing households, we could create a spreader event among the unvaccinated people. But grandma, it turns out, it's very, very unlikely that she's going to give it to the grandkids. And it's very, very unlikely that they're going to give it to her. And if that does happen and she catches it from the grandkids, she's going to have a mild case. She's not going to be in my ICU using up a ventilator bed.
I like to think of this first million. It's a great accomplishment. It's really exciting. We've had a good day here at the Department of Health when we talk about 1 million shots administered. But I got a feeling the next million is going to be a little tougher. We're going to have to work even harder.
Well, I totally agree with that. There were a number of people who were eager to get the vaccine and were gnashing their teeth waiting to get a vaccine appointment. Okay. And now we are opened up on all the other counties to 16 and above, and in your county, starting this coming Monday, it'll be 16 and above. That's wonderful. Okay, congratulations for,
Thank you.
for getting that. Yeah, I mean, my 17-year-old son here in the house has been vaccinated, and I'm very, very pleased with that. Yeah, you're right. The next million are not going to be the people that have been chomping at the bit to come get the vaccine. Okay. They are the people who have been on the fence. I think there's a cadre of people out there that we may never convince, and that's okay with me. There are religious reasons for not getting vaccinated, and some people are into the political conspiracy theories and all that stuff. I don't pretend that I can persuade those people, but the people who are on the fence, the people who've been watching and waiting to see what happens. Well, I don't have improved 5G reception. I didn't grow a tail. We haven't really seen the infertility, which has been the big concern, especially on our North Shore here. We haven't seen that at all.
Let me ask you about the Johnson & Johnson. As you know, the whole nation paused on the J&J earlier this week. And right now we're not administering Johnson & Johnson shots because 6 people developed blood clots. Out of 6 people out of 6.8 million people who had received Johnson & Johnson. So the odds are long, but you know, we at the Department of Health are all about safety. I know you are too. And so we are okay with this pause, but I wonder what your thoughts are on that product going forward.
I think it's a great product. I have hopes for it being our darling ultimately. Because it's refrigerated, not frozen. It's 1 shot, not 2. It's easier to get it out to the third world where these variants arise in areas where the virus is spreading unchecked. And you get millions of viral replications. And with each one of those, there's a chance for a mutation. And if that mutation confers some advantage to the virus, then it tends to persist. And the 3 that we've been dealing with, as you know, the South African variant was found in Honolulu in a non-traveler over a month ago. So it's real and it's here, okay? It's the B117 variant, the UK or Kent variant that is shutting down Michigan as we speak. Those variants are real. But if we get enough herd immunity out there, those variants are less likely to emerge. So far, every vaccine in the world, every one that's in use in the world, is effective against every variant that has been discovered. They're less effective. So in South Africa with AstraZeneca and J&J, they had a lot of cases. They had a number of hospitalizations, but still no ICU admissions and no COVID deaths, okay? So those vaccines are still effective. One of these days, there will come along a new variant that has a brand new spike protein, and we'll have to get called back for a booster of a slightly modified vaccine, okay? To put that in perspective, you asked about the J&J. It looks like you have another question on your mind, but just to finish with the J&J thing real quick. 6 cases out of almost 7 million is pretty darn good. The good news about those 6 cases is they were discovered. There has been intense surveillance of vaccine side effects like we've never, ever seen before. Okay, it didn't take 200 cases for somebody to say, oh, wait a minute, something's wrong. It took only 6 cases and boom, they came down right away and put a pause on J&J. That's the way it ought to work. They had a big meeting yesterday. We were listening in with the ACIP, the Advisory Committee on Immunization Practices at the CDC, and they could not decide for sure. They said, okay, let's reconvene in 1 more week. And so the pause will last for another week. to put those 6 cases in perspective, now, if you're the one who died or you're the one who's in the ICU, statistics don't matter, okay? It's horrific, all right? Okay. But for those 6 people, they were all women between the ages of 18 and 48. If we just look at how many COVID deaths do we have between the age of 18 and 48, it's 125 per million, not 1 per 7 million. Okay, so the COVID remains, the virus remains dramatically more dangerous than the vaccine. Having said that, like you said, we're all about safety. The doc from Stanford yesterday in the meeting, I liked what she said. I don't remember her name, I'm sorry. But she said, in this country, we have no tolerance for friendly fire. And I like that, okay? That's how we look at it. If the vaccine might be causing a problem, okay, let's back off. We're lucky in this country that we have enough Moderna and enough Pfizer to get by.
Dr. Sparks, one last thing. Another development this week, Pfizer has said that it is likely, is the word they use, that you're going to need a 3rd shot. You're going to need a booster. This really isn't complete news to us. We've been talking about this for a while, but your thoughts on possibility of a booster, 12 months down the line or so?
I think it's too early to know if we need a 3rd shot, but if we do, it will be a booster because of a new spike protein in one of the variants. And the good news is, a month ago, the FDA already told Moderna and Pfizer, hey guys, you can modify the RNA using CRISPR, a little cut and paste of the nucleic acids. You can modify that mRNA and we'll still call it the same vaccine. So you could get it to market in 2 weeks. You don't have to jump through a year's worth of hoops to get an emergency use authorization. So if we have a variant that makes a new spike and, oh my gosh, we have to come back for a booster, it'd take a couple of weeks to get that to us. They already have created one and they've already given it to 500 people as part of a new trial. But do we all need to come back for a booster? I don't know. My own guess is this immunity is going to be long-term. After the 2nd shot of Pfizer and Moderna, after the 1st shot, you've got antibodies within hours. That night when you can't roll over on that shoulder, that's your antibodies fighting against the spike protein that you've already produced. It happens that quickly, 8, 10, 12 hours, and you already have quite a bit of immunity to the virus. But after the 2nd shot, your memory T cells kick in. And those are the guys that give you the long-term immunity, months or years. And my guess is the immunity that we have from these 2 vaccines is going to last for years. It's a guess.
If there's one message to come out of tonight, if there's one really tight message for people as they consider being vaccinated as we march into our next 1 million shots, what would your message be?
That hugs are coming back, okay? These are miracle drugs. I don't use that word very often, rarely in my lifetime. But in my 50 years of doing this, I haven't seen anything that I could call a miracle drug like these vaccines, all of them. They're miracle drugs, go get them.
Thank you, Dr. Sparks.
Get whichever one you can, as early as you can, yeah.
Dr. Sparks, we really appreciate your time. Thank you so much from the island of Kauai for sharing your knowledge and your experiences working at the vaccination clinic there in Lehui. Have a good evening. Thank you so much.
You're worth it.
All right. Hawaii, you are worth the vaccine, and we really appreciate what you've done to get us to this point. Wow, 1 million shots already, and we march onward. We're really excited about where we're headed, and thanks to all of you, we are going to get there, Hawaii. We are going to get there. One last thing before we bid you adieu, and that is to update you on the vaccine allotment that we expect next week. First, I'll tell you that this week, the week of April 12th, we received 76,060 doses of COVID-19 vaccine. We're going to get just a little bit less next week. We'll be getting 73,120 doses the week of April 19th. Now, it's important to remember that just as we're receiving a slightly smaller supply of vaccine from the federal government, Oahu will be opening up on Monday, April 19th, eligibility to everyone who is 16 and older. So eligibility is expanding. Our vaccine supply is shrinking just a bit. That means people on Oahu will continue to have to be patient while they wait for that shot. but everyone is going to get an opportunity before too long to be vaccinated. And we really appreciate the fact that you are willing to be vaccinated. You're willing to wear that mask and continue to physical distance. Let's beat this thing together. Thanks, Hawaii. Thanks again to Dr. Sparks. And we'll see you next time here on the Weekly Dose.